Critical conversations, building strategic partnerships, and finding new value. The opportunity is here for you at the NIC Spring Investment Forum. Hi, I'm Renee Stoll for NIC TV. The NIC Spring Investment Forum is bringing together leaders in healthcare, senior housing, home care, finance, and care coordination. Their discussions center on how changing demographics of seniors, dramatic changes in healthcare delivery, and advances in technology are fostering opportunities to collaborate in delivering more closely coordinated care. They're also wondering how the current political climate will affect the industry. Some well-known Washington insiders took to the NIC stage. Former U.S. Senator Tom Daschle and Bill Frist provided their insights on the new administration and what it could mean for seniors' housing and care.
I think most Republicans and Democrats would say, if you're going to support health reform, what are we trying to do? And I'd say that most people would say, well, we're trying to build a high-performance, high-value healthcare marketplace with better access, better quality, and lower cost. I don't think there's much disagreement about that. The disagreement comes over the role of government in getting to that goal. That's in large measure why it's so complicated.
I think what we're going to see is that social contract, taking from the rich, giving to the poor, is going to be not quite as much emphasized. And the issue is, how much should it be emphasized today?
Could you give us your final thoughts in a one-liner, 140-character tweet as to how you see the future of healthcare for the operators and for the investors in this room?
My tweet would be, in this healthcare transformation, our success depends on resiliency, innovation, collaboration, and engagement.
Senior care is a growth industry. High touch, high value, brand, and attention to the consumer will prevail.
The care silos must break down as future returns in senior care depend on it. That's the word from this power panel during the opening general session. The consensus is that value-based care is rapidly transforming the healthcare marketplace, so real estate-based providers can benefit by partnering with non-real estate-based providers. The additional value created will help secure future returns in senior care.
We did this because acuity was rising, length of stay was becoming shorter, and obviously we saw that eventually having an impact on our census. If you add to that new competition, it gets more difficult. So that's why we did it. We didn't do it to participate in an ACL. We did it as a market differentiation strategy, as a way to be successful.
So the trade for maybe some additional investment on the corporate side in IT, and perhaps additional staffing, the medical concierge at the facility, you're getting longer lengths of stay, better customer satisfaction, and therefore, hopefully for the investor in your facilities, better bottom line performance as well?
So longer length of stay means more people in beds, right? More people in beds, if you can control your expenses, means more EBITDA. More EBITDA means value. Yeah.
Okay. So investors like that outcome.
And it's drawn people into the marketplace that previously were not in the marketplace.
Conference attendees are finding practical, actionable strategies for their businesses. The strategies are found in sessions covering three primary areas of focus: economic, capital, and policy trends, creating successful partnerships, and capturing value. This session uncovered opportunities and challenges in managed care.
As a former operator within Medicare Advantage, I know how hard it is really to turn the needle on utilization. Until you really empower the providers with data and dollars, it's difficult to get that constraint. And I think what we're seeing in today's market is the fact that the distribution channel, whether it's physicians, whether it's hospitals, through these programs, whether it's bundle payments, other episodic payments that are being tested, Medicare shared savings, and different levels of Medicare shared savings program, is having a real impact on the business.
Next, this panel took on the challenge of responding to slower than expected lease ups.
I think the key part about opening new development and private pay senior living is making sure you've hired the right marketing directors and the right executive directors, and doing it early on before you even get close to opening the community. From the bank's perspective, from my perspective, we want as much due diligence on the front end before you get into a market as possible.
And creating successful partnerships is one primary area of focus at this event. These sessions encourage you to think outside silo walls.
A silo of care is a hospital. A silo of care is an assisted living facility. A silo of care is a skilled nursing facility. Typically, a resident will go across all of those, and nobody from any one of those organizations will actually communicate with each other or manage the care on behalf of the patients, left to the family to do. This is a matter of creating a much more holistic and resident-centered system of care.
The conference education program certainly gave attendees lots to talk about during their networking breaks. Executives used the time to advance their business.
This is really an opportunity to have multiple sales calls in one location, because when you cover a large swath of the United States like I do, this is much more efficient for me, because if I can see customers from Florida, Texas, Boston, Pennsylvania all in one setting versus going to see them 2 or 3 days at a time. So not only is it more efficient, it's actually more cost effective for my company.
We come here to make connections, get to reconnect with all those in the industry. It's a great spot to meet with the capital groups as well as the operators, so and understand what's going on in the industry right now.
Kind of like a one-stop shop, so you get to see everybody in one place, catch up with them, and also talk about, we get to talk about our projects and hopefully make some deals happen.
What a productive day here at the 2017 NIC Spring Investment Forum. For NIC TV, I'm Renee Stoll. Thanks for watching.